Healthcare costs are skyrocketing, and changes at the federal level could lead to thousands in Mid-Michigan losing coverage altogether. Congresswoman Kristen McDonald Rivet hosted a roundtable with local leaders this afternoon. Mid-Michigan Now's Andrea Flores tells us more about what these changes mean for families, businesses, and healthcare workers.
The Affordable Care Act open enrollment period started over the weekend on November 1st, and many Michiganders are facing tough decisions. Congresswoman McDonald Rivet says the end of enhanced tax credits and massive cuts to Medicaid are leaving more than 32,000 people in Mid-Michigan at risk of losing health insurance.
In Mid-Michigan, where 70% of our jobs pay less than $60,000 a year, how are you supposed to absorb tens of thousands of dollars of extra costs coming out of your take-home pay? It's not possible.
U.S. Representative Kristen McDonald Rivet says the ending of ACA tax credits and $1 trillion in Medicaid cuts are pushing healthcare out of reach for thousands of Michiganders.
What is apparent is that we are creating two very different Americas, where health is a privilege, where you have to be wealthy to guarantee that you have access to food.
For some local doctors, they're seeing the impact firsthand.
People get afraid. They wonder if they have that. They wonder if they'll get access to their health care still, if they'll be able to take their medications.
Dr. Aisha Harris says there are serious health implications when people can't access health care.
Then they get sicker. When people get sicker, some of them die, but some of them aren't able to work anymore. Some of them aren't able to go to school anymore.
The strain is also being felt by small business owners, like Jessica Brown, who runs Wayfair Travel Group.
I provide my own health insurance through the Affordable Care Act, and my premium is doubling from $450 a month to over $900 a month for less coverage.
Brown says that reality also affects the people she employs.
You have employees that are now making less money. They have to make choices between whether they're going to continue their coverage or if they're just going to go without. They may be looking for a different job that provides a better health insurance plan, so you're losing your talent.
Cherie Stapleton, a community healthcare worker and founder of Mothers of Joy Institute, warns that families already under pressure could face even greater strain.
It's going to be a ripple effect, and it's going to affect all of us.
Congresswoman McDonald Rivet says she's pushing for bipartisan action.
We can't let our country get to a place where you only get a mammogram if you have money. Your kids only get to see the doctor and go to well checkups if you have money. And this is where we have to start pushing back.
Congresswoman McDonald Rivet says she'll continue to fight to create a healthcare system that works for everybody. In the studio, Andrea Flores, Mid-Michigan Now.